when I had a chance to visit some homes in this area as a guest of SWPA, Environmental Health Project, and talk to people about some of the concerns they had about their health when they were near natural gas activities and drilling, is that many of them wanted to really talk to me and the other people I was with about the pets that they had and some of the animals in the backyard or their farm and the health of those animals. And what this case really starts to talk about is what's the role of physicians when you get questions about non-human animals, and what do you do about that? And my background, by the way, is that I'm like Pune. I'm a family doctor who then went back and did a fellowship in occupational environmental medicine. So have some sense of what happens in the primary care setting as well as in the referral for occupational and environmental medicine problems. So this is a case of a patient that you're seeing for blood pressure control in primary care, and they've been living in that house for about 10 years, and then natural gas drilling began in the community about 2 years ago. And the patient gives a history that shortly after the drilling started, they noticed a change in the water, and there was a funny taste and some change in the color of the water as well. And one of the first things they noticed with their dog, who was a Labrador Retriever, was refusing to drink out of the bowl, of the water bowl, and they felt like there was something wrong about the water, and that made them more concerned about the water as well. And then the dog actually got sick, developed some diarrhea, and then died, and that helped them make sure they went and got the water tested, and they were told by some authorities that they checked the water test out with that the water was drinkable. But the patient is still coming to you now as the doctor and saying that, I'm still not sure this water's okay or the situation is good. My dog died, and should I be worried about the water or any other exposures where we live because of this illness in the dog? Okay, and it really pushes the fact that in medical school we don't learn anything about veterinary medicine. We do not know what a liver on autopsy looks like in a dog or what to make of it, and it just makes us wonder, though, about are animals able to serve as sentinels, giving us some early warning about something bad in the environment that could hurt us. And this is a coal miner with a canary, and in this country, in this area, coal miners took canaries down into coal mines to check for methane, to check for carbon monoxide in the mines, with the idea that the canary would get sick before the coal miner would die, and so the coal miner would have time to put on a mask or oxygen equipment and save themselves. But the question is, does this work in other situations as well? So they were very sensitive to the gases. They would get sick before the people were. So they were more susceptible compared to humans. And they had sort of the same exposure, although sometimes they can actually have a faster breathing rate and they can breathe more air and get exposed more. When you think about animals around a rural area where there's drilling going on and things, it's very likely that an animal may be more exposed to something that is out there in the environment. So if it's a water issue, maybe there's runoff water in the ditch. We don't drink out of ditches as much as your dog does, and so it's a very good likelihood that a dog or a cow or something that's out there would actually have more contact with some contaminated water than we would just getting it from our well. So there's many times where we have seen that animals really do give us early warning of some things in the environment. And a common example is lead. If you think about being in a house and there's lead in the dust, cats, it turns out, end up with about twice the lead levels that people in the house end up with. So that they're down low, and they're little fur balls, so they sort of pick up dust, and then they lick the dust. They lick their fur, and they lick the dust. So it's a great way for the cat to have much more exposure to the environment and something in the environment than we do. And also, animals don't live as long necessarily. If you have a dog, they have dog years. And so if you have a cancer like a mesothelioma from asbestos that takes in a human about 35 years to develop, in a dog it's going to take about 4 or 5 years, because that's how many dog years it is for the dog to get the cancer. So many things like a reproductive problem, a cancer, might show up in an animal sooner. So there's reasons why that we, even though we have no training in this at all, there's reasons why we probably shouldn't just blow off a report of some sick animals in an area where there's humans living nearby. And so I think the ways that we do it, there's some challenges to doing something about it, but what I want to encourage you for is basically just don't blow it off and consider whether they can give you some good information that you can use for your patients. And one of the reasons why is that there have been reports of cows getting sick, of dogs getting sick, breeding problems in farm animals related to gas extraction activities. And I think it's been hard to always investigate fully each of these episodes, but they're out there, and it's another reason why I think we need to consider is they're telling us something useful that we might be able to use when we're taking care of the patients. These are the challenges. We don't know much about vet medicine. We're supposed to treat people. Vets are supposed to treat animals. And we really do not have, usually in our community, a way that that the doctors can talk to the vets or the vets can talk to the doctors. We go to different meetings. We go to different sort of conferences, so we don't really have a regular way to talk to each other. We don't see each other at the hospital and things like that. So just 4 things that I'm going to suggest, and this is in your toolkit, and we have some resource numbers and things in the toolkit, is that if a patient's concerned about health in the pet and they think it's because of something environmental, some hazard in the environment that they think could have caused the pet's illness, just acknowledge that the pet's illness can be very important to the patient. It could be very a traumatic experience for them, and they could be very concerned about it, and don't blow it off for that reason. See if there's any evidence that a veterinarian made a diagnosis or did an autopsy. Like you said, much more than humans, animals that die get autopsies by veterinarians very commonly. We do that. That happens a lot. And then, as you said, find out what the exposure is. Use this as a way to ask about, is this a dog that's been drinking out of the ditch a lot? Is this a cow that has been drinking out of a particular spring or a water source where that really could be a tip-off that there's something wrong with that source? Is there anything else special about the exposures that the animal has that can tell us something about these possibility of these exposures being shared with people that you're taking care of? And then find somebody to talk to who knows more than you do or I do about veterinary medicine. And that could be the veterinarian who's seeing the dog or the cat or the animal. And it could be there are some referral veterinarians who have expressed a willingness to take calls from doctors about cases like this. And these are, there's 2 names here, the state veterinarian, there's a state public health veterinarian. That's a veterinarian who works for the state public health department. And there's a couple other names in your resource sheet. So, just something else to think about. It's another way to get information about exposures for your patients on top of the exposure history that you're taking.